Hi, I'm Dr. Rutherford. I am a certified functional medicine practitioner here in Reno, Nevada. This is my colleague, Dr. Randall Gates.
I'm a board-certified chiropractic neurologist.
And together we work with the nervous system, the brain, the neurology of the body, as well as the metabolism of the body, meaning blood sugar and all the different things that gut problems, endocrine problems, just pretty much every physiological, biochemical thing you can imagine that takes place in the body outside the nervous system. Put those two together and have developed some novel approaches, as Dr. Gates likes to say, for chronic pain and chronic pain conditions and chronic conditions in and of themselves. We've been doing this for a while, so we just like to share our observations with you when we see something that has relevancy. The topic is gluten and fibromyalgia, and we probably have about 25 hours to say on that. We're going to make it a few minutes though. There are other things, other presentations that we have online if you're wanting to look at the more expansive aspects of what we're about to say. But gluten is one of our few consistent recommendations to our chronic pain patients that come in here. One of our clinical pearls in this office is treat the patient, not the diagnosis. In other words, everybody comes in, I get 100 people coming here with fibromyalgia diagnosis, and they're all slightly to drastically different. Same thing with most of the things that we treat. But one of the things that we see consistently, in fact, it's our only consistent recommendation to all of our autoimmune patients, and if you have fibromyalgia, if you truly have fibromyalgia, I'm going to tell you you're an autoimmune patient, is to get off gluten. And we've seen varying degrees of consistent success with that recommendation, and thus it's the one thing that does stay consistent within that diagnosis is to get off of gluten. The problem is gluten is a very, very complex subject, way more complex than just getting off of gluten and would pretend, and it's very controversial. So that's what Dr. Gates is going to discuss here, and I'll probably jump in a little bit. I may or may not jump in, but why don't Dr. Gates kind of has prepared for this relative to a few things that have come out here lately. Why don't you go ahead and get into gluten and fibromyalgia for the listening or audience?
Okay, so let's just get into the nitty-gritty of it. There was a study that came out in the Clinical Experiments of Rheumatology journal in 2013 where they said, fibromyalgia patients beware, you shouldn't go off gluten unless you have celiac disease. However, in a Rheumatology International journal that came out this year, they basically did an experiment where they took 20 fibromyalgia patients and they had criteria of would pain decrease, would you be more functional in your day-to-day activities, would you not have as much brain fog, things of that nature. And they put fibromyalgia patients on a gluten-free diet. Every one of them improved. It's very interesting.
To varying degrees.
To varying degrees. What we've observed clinically is that we put our patients on gluten-free diets about 4 to 5 years ago, and we saw that fibromyalgia patients would oftentimes improve. We've since come to learn that it's far more complex than just gluten, as Dr. Rutherford alluded to. We have many videos on powerhealthtalk.com regarding fibromyalgia as well as YouTube, but just to summarize fibromyalgia, know that lots of times there is immune inflammation associated with the condition. That's why Dr. Rutherford is saying that many of you have autoimmune disorders, as well as the fact that many of you have been through horrible abuse through the course of your life. And that stress has created a response in your brain such that you produce too many stress hormones, and those stress hormones can make you more sensitive to pain. We're also seeing that some of you now have peripheral neuropathy, and you didn't know you had peripheral neuropathy. So it's this very complex condition, but
peripheral neuropathy is pain, numbness, burning, tingling in your feet. A lot of you are like hurt everywhere. I can relate. I was diagnosed with fibromyalgia, but a lot of you will feel pain everywhere and not realize that the feet may be a separate issue from all of the other wonderful pains that you're feeling intermittently and going from here to there and all over the place and so on and so forth.
And what we're seeing is that the gluten can be an underlying factor for all these things, and that gluten may be crossing over with fibromyalgia and what is termed now non-celiac gluten sensitivity. Non-celiac gluten sensitivity is a diagnosis that came up in the 80s but gained acceptance really in the last 10 years by this gentleman named Peter Gibson. And basically it entails a person eating a gluten-rich diet, then they go off of gluten, not eating it, and then they introduce gluten back in, and if their symptoms come back after introducing gluten, then we can conclude they have non-celiac gluten sensitivity. And that's what we're seeing in part relative to fibromyalgia patients, not only in the studies, but clinically, where the gluten can not only cause gastrointestinal problems, but more often, things like muscle pain, things like brain fog, things like depression, things like burning and tingling in the feet or the hands. And that's really where the rubber is meeting the road. And that's where, if you're watching this video, you're going to be on the front of the wave and understanding how gluten, this protein from wheat, barley, oats, and rye, can not only cause gastrointestinal problems, but can go in and cause a host of neurologic issues, like fibromyalgia being one of them.
Yeah, it can even cause other allergens. So if you get off of it, you feel good for a while, and then your symptoms come back. It isn't because you should go back on gluten. It can cause a number of different entities that Dr. Gates just discussed on our IBS clip. Most of you who have fibromyalgia patients, our experience is you do not have good intestines, that your gut and your colon usually aren't all that really happy. And the gluten can do that. I've seen studies that show that the gluten could actually be creating the milk allergy that you may be experiencing. So when we started out 5 years, 6 years ago, whatever it was, and it was very controversial then. It wasn't even controversial. It was basically all the medical doctors told our patients that we were crazy, except our patients were getting better at using that as part of what we were doing. And then it kind of calmed down. It seemed like it kind of calmed down. People were starting to, and it's still calming down to a degree, but then all of a sudden, in the last couple of weeks to a month, there's been this wave of maybe not a wave, but there's
a resurgence.
There's been a resurgence. Perfect. There's been a resurgence of controversy about, oh, it's this and it's that. Some of it's the marketing of it. Some of it's the gluten-free products that are out there that we could go on for hours about, because most of them are not good, and a lot of them are not good for people who are sensitive to gluten, because they have other things in them that react in the same way as the gluten molecule. They're called cross-sensitivity. So it becomes a very complex subject, and because those are being marketed for profit basically only, not because they're these great nutritional gluten pretzels, or stuff along that line, and people think they can eat them. It affects their blood sugar, it causes other sensitivities, and so on and so forth. It's been hit from different sides that it's a fad and it's just there to sell. There's a faddish part to it, but for those of you who have fibromyalgia, it's real. And as a clinical pearl, you would be foolish not to get off of gluten for a month and at least determine whether you've seen improvement in your symptoms or not. As Dr. Gates said, every single person in that study experienced improvement in certain symptoms. Different people are more sensitive than others. Some people just, will see dramatic improvements in their symptoms. If you see dramatic improvement in your symptoms and you go to your doctor, he says, let's test you, and he tests you, and he says, oh, you're not allergic to gluten. Don't go back on gluten. Just go by what you feel, okay? And I think that would be your best bet on the gluten and fibromyalgia topic.
Okay, yeah, and make sure you're eating a well-balanced diet. We always want to say that. So anyways, if you have any more questions, you can go to powerhealthtalk.com. You can send us questions there. You can watch our videos there. You can also like our Facebook page. It's Power Health. And we'll see you soon. Thank you for watching.